Awesome. We're back at Sentara Studio. I'm Abby Lemon-Stevens, and I'm joined with my co-host, Chase Spurlock. Today, we've got Jon Pickering, CEO of Mizaic, a UK health tech company at the intersection of clinical records and clinical decision-making. Jon, welcome.
Thank you.
Thanks for being with us.
Thanks for having me.
Yeah. Tell us a little bit about you, Mizaic, why you're in Nashville.
Start a little bit about me. I about 25 years in healthcare. I had a co-founded a business back in 2006, my first sort of healthcare venture, selling to the NHS, and I've been there ever since. Exited that in 2017, and then got back into this role 3.5 years ago when I was headhunted by the chair and investor for Mizaic to come and help sort of mature and scale the business in the UK, but also look at international opportunity as well.
Incredible. So tell us a little bit about Mizaic. What work do you do?
Yeah, so the way I describe it is we're experts in unstructured data and clinical documentation. So we have two products now. We were just one product for 9-10 years of the first 9 or 10 years of the business. But a product called Mediviewer that's sold into nearly 30 hospitals now in the UK. There's a need to collate that holistic patient record, so there's a full visibility for the clinician at the point of care. So we deal with the clinical documentation, which is the bit that EMRs are not so good at. Then in October last year, we made an acquisition with a product called Leo, which helps streamline the referral process. So firstly, what it does is it streamlines the whole administrative side of it to start with, which is taking the fragmented data sources, structuring that for the administrator to then push it further down to the clinician. But before it does that, it then assesses all of that information, clinically codes it, assesses it against guidelines or local protocols. It presents an AI-assisted triage decision at the point of care. So what it effectively does is gets rid of that constant loop of feedback loop where they're missing information or not appropriate information as well. So it solves that problem. I'm hoping it's going to resonate with the US market.
Yeah, it's incredible. It sounds like it could really resolve a lot of clinician burnout and stress too.
Yeah, it's the same type of problems we've got in the UK, you've got in the US for sure, but it's obviously working out how we navigate the US healthcare system as well at the same time.
Yeah, absolutely.
Yeah, and to that point, the AHR market's pretty competitive. So how do you differentiate, the Mizaic offering? And I imagine you have to pitch it differently, for a U.S. audience versus how you're selling into the different trusts in the United Kingdom.
Yeah, definitely. So in the UK, we have the point of one of the presentations today from Shane. You heard about him talk about this analog to digital strategy that the NHS have got. They've got a big paper problem, and we're trying to sort a lot of that out with the solution.
Yeah, they still have physician offices like with a reams.
Yeah. They've got up to 200 million documents in one hospital, which is quite a vast amount of information that's untapped for clinical insight. So we're helping trying to solve that problem. But the difference between that and the US market is quite that you haven't got that sort of paper problem. I understand, but there's definitely a need to, I think, mine that data better, because what we do is what the EMRs don't do is around that sort of unstructured clinical documentation side, which is the paper, the different things that are hard to read. We ingest all that, we read the data, but then we allow clinicians within 1 or 2 clicks to get to what they need to get to. So that's the problem we're trying to solve. And positioning our proposition, Mediviewer, which I've been trying to do that for 2 or 3 years into the US market, it's a big challenge. Alongside Epic, because the constant message that we hear is it's either Epic or it's Cerner. We've invested 50 million, 100 million in this system, and it does all of that stuff for us. We know it doesn't, but it's still a challenging conversation to have with the right stakeholders to get them to see the value in what we do alongside the EMR. So we're just trying to work out how we navigate the more complex US health system to get to the right stakeholders, and also define our positioning into the market as well, because I think that's a key thing for anybody that's coming to this market, is working out not just what your proposition is and your value proposition, it's who to speak to and how to, I suppose, push on the right buttons with the organization that you're meeting as well.
Totally.
Yeah. So the announcement we just had on our podcast, Lori Odom with the Chamber and Sam Davidson with the Nashville Entrepreneur Center, They just announced at this event the Lite program, which sounds like it's probably perfectly geared for a company like yours. Tell us what having access to a group of US based mentors, people that can really champion you and Mizaic, what does that look like? How does that feel? Are you excited about the program?
Yeah, I think it's a great opportunity for people to sort of engage. And just touching on the point I just made, I think getting involved with the right stakeholders, having credibility, having a look at how your proposition in more depth to work out what the position is into the US market would be really important. I think then understanding the US reimbursement model, what the key drivers are in the market is going to be really important to try and get that understanding for all the entrepreneurs that come across here, of which I feel like a new entrepreneur coming to the US market, because it's like learning again a new health system. One thing's having a product, but then it's working out how to position it properly with the key stakeholders.
It's kind of like a known front door, and it's a way to at least get some bearings. And we certainly, like when we have gone to London and Leeds, and even the most recent trip to Belfast and Dublin, to be able to have that group of people who is that kind of opening conversation that can then lead very intentionally to the second, third, fourth conversation. It's incredibly valuable, but it doesn't happen overnight. And, I think you and I first met maybe a couple of years ago, and you were forging that yourself in many ways.
Just to help understand and to sort of pave that path, because I think the hardest thing coming across here is you haven't got people on the ground. You're trying to establish if there's a business case for putting people on the ground, and you've got to get that traction first of all to sort of prove the business case. And it's a great opportunity for people to engage with that program and then help them push it along, because I feel very lucky in the UK, but we've worked hard at it, building that. We know every single NHS trust. We're selling to 250 hospitals. It's quite a simple business model. We've got 2 propositions to position to 250 hospitals. So it's, exactly what you're doing. And over 10 years, you build up that stakeholder base and credibility in the market. But obviously bringing that transatlantic and bringing it to the US, you're forging a lot of those, starting again effectively and trying to work out how to do that. So I think it could be great for that.
Sounds pretty daunting, but you certainly don't sound scared. You sound up for the task. But what does scare you most about the US market? What's exciting about it?
I think it's quite easy to burn time and money over here. We've burned a little bit, but not a lot. I think I've been quite measured with how I've sort of invested the time and effort in the market. I've learned a lot in that process. I was talking to one of the guys today and just giving them some general advice, because I've been doing this for a couple of years now without success. And I think I've learned a lot of lessons that I'm taking forward in the Leo products from what we learned with the conversations we had around our other product, Mediviewer. So I think it's quite easy to burn a lot of time and money. I think health systems are looking at a lot of different technologies, and it's about improving efficiency without creating operational burden. You want to make it sound really easy for them to procure your product. But then I think the procurement aspect and the stakeholder management aspect is probably scary to a lot of the entrepreneurs that come across here with new technology. That's quite a difficult challenge to overcome, I think.
Yeah. I think that's another reason why we're hoping to establish this Lite program as kind of a designated path to know where to start. And a lot of people, such as yourself, that are serial entrepreneurs, they already come with connections and friendships and relationships. But for those who are really starting from ground zero, it's at least a place to land and expand.
Yeah, it's exciting though, right? I think there's definitely a higher desire for innovation over here from CIOs and CCIOs and CMOs that want to engage with technology to try and help increase that. I suppose you've got the same pressures as what we have. Workforce are tired, workforce are overworked. You've got to look for that getting more out of less. And it's a really difficult sort of challenge, but I think the appetite for innovation over here is one that excites everybody that I've come over on this US trip with.
Incredible. So you've got several years behind you as a CEO. What's one thing you'd tell some of these new guys to do differently?
I think it feeds back into some of the things we've already spoken about. I think I wish I'd intentionally spent a bit more time trying to understand our product positioning in the US market, so that I could have fed those bits of information and those use cases back into our product development roadmap back in the UK, so that when you come out here, you've got a product that's ready for the market. I think start building relationships as early as you can. But that's also a catch-22 situation, right? You can't build relationships because you haven't got them. And that's where the value of our relationship and the one with Eric, it's just helped us understand the system a bit more. And I think applying some of that learning, and that's what I've been just talking to my colleagues about on the trip, is just, this is where I've spent time and money and energy to just try and learn these lessons. And I did something really basic today before a meeting that we had last night. So I thought, my pitch was okay yesterday, but I thought I could have done a lot better than that. That was not really as sharp as I could make it. But, and you tend to get better on these trips as the week goes on. So by the time it was Thursday afternoon, it's pretty good, right?
Your jokes don't land.
So I did a little bit of time last night, and I unapologetically went on ChatGPT, my instance of ChatGPT that knows everything about my strategy, and Leah, Mediviewer. I said, how would you apply Leah into the business that was meeting today and their strategic objectives and priorities? So I did and so that at least in my presentation today, I spent at least 20 seconds just positioning against their strategy and where they were. So it landed a lot better today, and I see a lot of nodding heads because I just tried to spend that little bit of effort last night trying to work out the business I was going to be in and then tailor the message. And that was key today. That was one of the messages that came through, right? So, yeah.
Okay, let's have a little fun before you leave us.
Go on.
Okay, Nashville has a reputation for music, hot chicken, and healthcare. Which one have you leaned into most? And is there anything that you're hooked on? You like Broadway?
I went to Broadway on Saturday evening, so my embarrassing story, I don't know if it's a good thing or a bad thing, but I came in with jet lag on Saturday evening and then ended up getting back to the hotel at 3:30 in the morning. So that's pretty good, right? Not a bad first effort.
Tour of duty. Yeah.
That's
And then I've pretty much gone to Broadway for an hour or so every night. I've had some hot chicken, not XXX.
Yeah, smart move.
Yeah, so everything's good so far.
Okay, one final question for us. For Global Health Innovators, one of our mantras is that serendipity, it doesn't happen by accident. Tell us about a moment of serendipity in your career for Mizaic, something that's clicked, that ended up being an exactly right place, right time kind of moment for you.
Back to my early career, I think right place, right time. I think one of the key parts of my journey in consulting and my career was the moment I realized as a supplier, and I worked on the customer side, that I was just getting sold to and people were just trying to sell me technology and not worried about the outcomes. And this is going back 20 years or so, right? When consultative-led selling became a thing, I was sick and tired of these people landing technology on my doorstep and then my engineers having to work out how to deliver it. So that became my first business idea, was create a Cisco partner, it was at the time, that invested in outcomes for the customer, make sure we delivered exactly what we said we was going to deliver for them. So I think that served me well through the rest of my career. So
incredible. Jon, thank you so much for being with us.
Thank you.
We're super excited to watch Mizaic's journey and see how you land in the US.
Thanks very much, guys.